with data when it's shared, and really helped create my vision of, hey, I think we can do more. We can get better data. We can do more with the data that we have. And so I am very excited to be able to be a part of this panel today and share some of my ideas and thoughts and learn from you about how we can do better as a community to really use data to better serve the people who are struggling in our community. Thank you for having me here.
Thank you, David. And Peyton, perhaps you could introduce yourself and spend a couple of minutes as well.
Certainly, thank you. Thank you to all who are attending. My name is Peyton Richardson. I am the currently Data Research and Policy Director at Eastside Pathways. Our mission at Eastside Pathways is to empower community leaders, foster connections, support East King County by collaborating, researching, convening, and providing training and resources to our partner organizations kind of dedicated to improving systems over time and intergenerationally. We have about, between 68 and 70 community partners, organizations, community members, businesses in many, many sectors that are working towards improving outcomes for youth and young adults in ages 0 to 26. And as a collective impact organization, we model our work on those 5 conditions of collective impact, which you will hear about. So we definitely have a lot of experience there. And as working in data, it is definitely, obviously, it's the job that I have, and kind of what's relevant to today. One of the conditions of collective impact is shared measurement systems. And in my role, I don't do a lot of primary data collection, but rather a lot of, collecting and analyzing, visualizing and contextualizing of data. So I'm thrilled to hear from the fellow panelists and also just really talk about some of the successes and the challenges and what opportunities we may have to, as a collective, think about data differently, think about the data that we do have, what might need to be collected, and how we can bring in different stakeholders, and most mainly the community that own the data, to be able to make some really great data informed decisions, making sure that we have that we come to the answers that we need to solve some of these challenges. So look forward to talking to you all.
Thank you. And Mo, if you wouldn't mind.
Oh, unmute yourself.
Oh, there we go. Okay, thank you so much for having me. My name is Mo Chada, and I'm actually here in my position as a CBO leader. I am with the Association of Zambians here in Seattle, AZISWA. I'm a board member, as well as also I'm a board chair for the Washington Coalition of African Leaders. And I have been working for the last 2 years with Healthier Here and Connected Community to kind of like create a CIE, a Community Information Exchange, which would be the first platform that we would use as a small CBO to be able to gather data and to collect data and use data like we've never done before. Being a small CBO, we do not have access to funds and resources to help us collect data. We have been trying on our own for many, many years to collect it, but it has been very, very difficult for us to keep up with it, to make sure that it is standardized, it is actual data that we need, that we're collecting. So working with Connect to Community Network is very exciting for me. I want to see what we're going to do with it. We have been using surveys for our community leaders, and we feel like we can do more. And I feel like this opportunity here, learning from the leaders here, how they've been doing it, and also maybe looking for opportunities for us to access ways of collecting data and finding ways on how to use that data. So very happy to be here. Thanks for inviting me.
Thank you for that. And thank you for being our panelist today. So again, my name is Karen Howe, and my interest in serving on the panel today kind of stems from the fact that I come from a business background. And so data-driven decisions is kind of what it's our personal motto to a large extent. And we try to do data-driven decisions when we are making good decisions for the city as we enact policy for the cities that we serve in. And what a tricky idea data-driven decisions. That assumes your data is perfect. That assumes you've actually asked the right questions. That assumes that you're not trying to force the data to fit into a specific little perfect answer that you want to be able to deliver to your constituents. And so data is by its nature problematic. Getting access to data is expensive, which was already brought up. It's also very dependent on how you ask the question. If you ask the question in a certain way, you can really color the outcome of what that result is going to be. And so I kind of experienced that to some extent when I was helping with the King County Homeless Authority's point in time count, where I found we were really restricted in the way that we could ask a question. And I know that there was rationale for some of it. Some of it's process driven, some of it's because HUD would only let you ask the question in a certain way. And some of it was, I'm trying to understand, why aren't I asking about couch surfers, for example, because isn't that a precursor predictor of people who might end up homeless, for example? So there are these gaps that I felt were there. And what I would love to see is a more holistic way to be able to get at data, but share it from multiple sources, and to have some way, some smart filtering system that would allow me to make good decisions, or maybe just say good enough decisions. I'm not sure there is such a thing as perfect data, but there is such a thing as making the perfect the enemy of the good. So trying to get to good enough so you can get off the dime to actually move ahead on something, fail, learn, move to the next thing. So I'll end with that and just say I'm excited about today's panel. I know I'm going to learn a lot, and I'll let Osman take off now.
Thank you so much, Deputy Mayor. And my name is Osman Salahuddin. I am the Communications and Community Engagement Manager for King County Council Member Sarah Perry. So I'm here in that capacity. I also happen to be a City Council member in the city of Redmond in my evening time. But, all of those things coalescing really got me thinking about, one, I just want to echo what Deputy Mayor Howe said. She spoke very eloquently about the importance of data and how we really need to be using it wisely. But it got me thinking back to a few years ago. I actually helped found a nonprofit called the BIPOC Health Careers Ecosystem. So really similar to the work that Peyton's also doing, but it's very specific to the healthcare field. And, what we found is data is only as good as how we're sharing it out and who we're actually trying to impact. And we can have, tons of data, Excel sheets full of data. And if we're not using it wisely, if we're not using it to its fullest potential and actually treating every data point as, in this case, as a person, as their entire story, we're really doing a disservice to the tons of data that we do collect. So one thing that I'm really proud of, and the opportunity that I have in my role with Councilmember Perry, is taking this collective impact framework, really collaborating with stakeholders and understanding, we all have to be a part of the dialogue. We have to lean in and be a part of the conversation. We found out, for example, through the census that Census and American Community Survey data that, our East King County regions and cities and towns have the highest percent of youth across all of King County. But when we're actually looking at that data point, what does it mean and how are we going to move forward with that? And so I'm really excited about this opportunity and the discussion that we have moving forward, and a great slate of panelists.
Okay, so Councilmember DeMichelle, we're going to make a lot of references throughout this to collective impact. And that is something that I want to be honest, the first time I heard about collective impact in the sense of what we're describing was with Peyton. And so Peyton kept referring to collective impact, and Kalika said something about, does everyone understand what that means? And I thought, oh gosh, I'm sitting here, I'm not entirely sure my definition is correct. So in this event, I just wanted to make sure if there's anyone else like me out there that we get a little broader explanation of it and the context and how it applies to data. So Councilmember Barbara DeMichelle is going to give us an overview of that.
Thank you so much, Elisa. And I am chair of the Eastside Human Services Forum, and collective impact is dear to my heart. So I think we work together to achieve great results. I am very happy to read this definition of collective impact. I should also mention that I also am with Mo on the Community Cares Network, and that is establishing the Community Information Network, and have learned the complexities, the really deep complexities of gathering good data, and also how do we do it across platforms and make it so that it's easy for small agencies like Mo's to share and collect data, as well as some of the larger organizations. So here's the statement about collective impact. Collective impact involves the commitment of a group from different sectors solving a specific social problem using a structured form of collaboration. Participants in collective impact groups establish a common agenda. All parties agree on the primary goals and the approach to achieve them. They create shared measurement systems. Organizations agree on the metrics they will use to measure and report progress. They engage in mutually reinforcing activities. Each participant undertakes specific activities that support and enhance the efforts of others. They foster continuous communication. Consistent and open communication is maintained among all stakeholders to build trust and inform ongoing learning and adaptation. And they have a strong backbone support. A separate organization or team is dedicated to coordinating the various dimensions and stakeholders of the initiative. The essence of collective impact lies in the belief that these elements, when combined, produce alignment and lead to powerful results that no single organization could achieve on its own. It's about moving away from isolated impact and towards a collaborative approach where data and experiences are shared to create meaningful change in communities. So at this point, I'm going to turn it back to Osman to start the dialogue with the panel. And so take it away, Osman.
So I had to unmute myself. Thank you so much. And we're really excited about, again, we heard from the bios of the panelists, but really excited to hear from them. And so I have a few questions, and these will be directed to Peyton and Mo, and we'll start the conversation off there. So first of all, I wanted to ask, what are the key data sources that are currently used in human services and housing? For example, there's things such as quantitative data, qualitative data, looking at very specifically within those two or other sources. So the key data sources used in human services and housing. I'll start with, I can pass it to Peyton.
Thank you, Osman. The answer is just so many. I think that, in preparing for this question, I wrote down a good list. And, some of the quantitative sources that we use are big and broad, looking at overall systems, the U.S. Census data, American Community Survey, the King County Regional Housing Homelessness Authority, Communities Account, and kind of the list goes on. There's also looking at some of the academic outcomes of, common human service decisions. So looking at OSPI, the Office of the Superintendent of Public Instruction, and research like that. And for qualitative data, I know that I and a lot of our partners rely on some of the incredible work that comes out of our municipalities. Some of the human service needs assessments are incredible resources to really understand the story behind the numbers. I think Deputy Mayor Howe spoke about the questions that are asked, and I often feel like a lot of the qualitative data or even the descriptions about what's going on can further inform, the survey administrators or whomever to ask better questions. But, all that's to say that I think that it's such a broad and fluid mix to make sure that you have accurate data. And that's first and foremost. However, without kind of that qualitative context, the data tells a story and it'll tell a story all on its own. The numbers will speak for themselves. And without that qualitative context to really understand what's going on in individuals' lives or what what's happening in the overall system, those numbers might not tell an accurate story. So there's a lot of stuff that we can go to, but it's a dynamic mix of both that qualitative and quantitative data makes for more whole stories.
Thank you. And I'll pass it to Mo.
Yeah, I think just like Peyton said, it is a mix. Human services is pretty broad, and there's different sources of the collection of data. I wrote down some things as well. Human services, they'll use government databases to get that information for qualitative, quantitative. They also have surveys. Surveys are conducted, and information is gathered from there. Administrative records, you have census data, housing data. And for qualitative, for ourselves especially, we use interviews, we use stories, storytelling within our communities, within the people that we know in our community. According to cultures, we collect data like that. Although it is always changing because, again, it's like the deputy mayor said, it's always changing. It's how you ask it and how you get it and who asks it, right? And that's how you collect that data. So it's always changing. We also will use focus groups for ourselves. We have observations in our communities, in the small communities. We have coalitions in our immediate communities. We've come together with different CBOs in our organization to see. Right now we're dealing with the immigrant and the asylees. And so we're depending on these focus groups and the observations and the surveys to be able to gather that data. But again, it's like, who's asking those questions? Is there trust? Is that accurate? How do you get it? And does it tell the whole story? So there's different ways for human services to gather that. And yeah, it's pretty much that.
Great, thank you so much. Really appreciate those answers. And our next question actually pivots to some of the challenges. So the question is, what are the challenges to collecting accurate, consistent data across different agencies? And how can we ensure data accuracy and consistency across different agencies that do provide human services? So it's a long question. I could repeat it if you need, but I guess we'll start with Mo this time.
Yeah, it's a big challenge because, again, there's no standardized way in some communities on how to gather that data. You have different agencies that are working on different projects. They have their own ways of how they have different ways of how their case managers work, how they take that information in. And so to gather that information and to make sure that it is actually accurate, that's hard. It's a challenge. And then also another challenge is getting the community to trust you and tell you the story that you really need to hear, give you the data, the accurate data. That is hard. It takes a lot of time. It takes a lot of building trust with community members to be able to gather that information. Are they feeling safe? Is their data safe? Do they trust that this information is going to be used how it's supposed to be used? A lot of the people that we work with are vulnerable people. Immigrants. They are afraid the information is going to go this way or that way. And for that reason, they might not give you the whole picture. They might not tell you the whole story. So there it is there, the data is distorted. Those are the challenges that we have. And then we also have capacity. Do we have the capacity to go out there and collect the data and make sure that we bring it back and it is accurate? Those are some of the challenges that we're experiencing. We talked about also, the silos, right? The silos, everybody's in their own, each agency is doing things differently. There's no way that you can go in there in a database where it's collective and everybody's in there and all the information is standardized and you're able to do it. We're working in silos and that makes it very, very hard for us to get the data that we need, the accurate data that we need. So those are some of the challenges. I can talk about privacy and concerns and resource. For CBOs like myself, I belong to AZISWA, and AZISWA is a very small entity. We are all just, what do I want to say? We are volunteers. We work after hours. We don't have the resources. We don't have the capacity. We're excited now that we're going to be part of the CIE that Healthier Here is coming up with, but that's going to change the narrative for us. But this whole time we have been working without the resources that we need. And so that makes a huge challenge for us. So those are some of the challenges that we have. I can't remember part of the other part of the question. But yeah.
Yeah, it was, I think you answered it. It was, how can we ensure data accuracy across different agencies providing human services?
Yeah, it's just not standardized. It's hard.
Perfect. I will pass it on to Peyton.
Thank you. And thank you, Mo. I mean, I could just like nod vigorously and +1 every single thing you said. Many, many +1s. Some of the things that I would add, like I thought about like some of there are technical challenges of like, I think about like data interoperability, like the data doesn't talk to each other. Different people are collecting data in different ways that work for them at that particular time, but then you try and compare across agencies or longitudinally and it doesn't quite work. So there's like, in my head, this beautiful, albeit very expensive system of like a single secure cloud database where all human service agencies can feed in their data and like, you know, transform it and make it one. That's a technical solution, but I think that really what some of the things that Mo were talking about are so critical of like trust and capacity, and you know, I often find in our work that a lot of our smaller community-based organizations, they might not have a lot of data capacity. They might not have the resources to have a staff or deep databases, but they're really, really nimble. And they keep community at the center. When the community or the folks that they're working, folks that they're serving, supporting, and empowering, when those folks need to change or when something happens, a lot of those nimble organizations are able to shift, able to, you know, immediately understand, well, you know, we were going to do this thing, we were going to provide these services, but we've heard deeply within our community that these services, they're harmful or they're not needed right now or something else came up. So like there's that, and that's data that they're collecting. They might not be storing it in a way that we can all think about. And on the other end, you have organizations that have a high data capacity and they might have data teams, they might have databases. They're able to do the whole extract, transfer, load, and they can clean data and make it wonderful. And they might not be as nimble. This is not always the case, but there's that a little bit of the polarity of like these nimble organizations that are doing incredible work might not have the capacity. Larger organizations also doing incredible work, but they're not as nimble. They're a little bit more static. Things take a little bit longer. There's a little bit more bureaucracy. And one of the things that I thought about is that like, I'm not sure that organizations, I know that they think about sharing data. I live this a lot. I don't know what their metrics for success are as it relates to sharing data. So like, is sharing data like a KPI that organizations look at? I'm not really sure. In my experience, it's sometimes, but not all the time. And that kind of, when you're talking about sharing data across agencies, that's an agency thing that agencies need to do. And I understand there is FERPA and there is HIPAA, so there are structural barriers. But I do wonder if sharing data were more of something that was funded, something that was measured, might it be more prevalent. And there could be, because organizations are collecting accurate data, but might not know, to Mo's point, what's going on in the different silos. So just there's a lot there, but there are a number of challenges. But hopefully we all on this call and elsewhere can begin to solve some of those things.
Great, thank you both so much. And we just have one more question here, so we'll start with you, Peyton. And the question is, what ethical considerations should guide data collection in sensitive areas like homelessness and domestic violence?
I again want to speak to what Mo said earlier. It's trust. I think there are a lot of ethical considerations, but it begins with the ability for the individuals whom you're collecting data from to trust you, to trust your organization. And it's something that is not a one-time thing. So I think it's a larger culture of building that trust with folks that have the data. I think it's important to remember that this is sensitive data, any data, but especially sensitive data. This is the data of these individual human beings and it belongs to them. And it has to be handled with care. And it also really needs to be, in a way, that is obviously legal and abiding by the laws shared back. I think that oftentimes when data, sensitive or not, is provided or is collected, it may or may not be used, and it may or may not be used for good, or maybe not. But oftentimes the folks that are living in that data, they kind of just find out with everybody else, like, oh, this data was used for something. And I think that in my mind, a really ethical consideration when holding this data, this sensitive data, is to make sure that individuals know that, what you plan to do with it, how you hope to inform your decisions, and if those things work or if they don't. Either way, I think that's just a responsible thing to do, to really, really inform folks of what is taking place with their data. And I'll say that, and this is always tricky, I think about this a lot in my work, when we're all collecting data around really, these sensitive areas, and folks are opening up and being vulnerable, and trust has been established and maintained, the burden's on the person collecting the data to obviously keep it safe, obviously keep it secure. But when you're using it to show integrity, when you're telling that story, to not tell a story of deficit and a story of just all things are awful and that's why we need X, Y, and Z, but rather tell a story of growth, tell a story of assets. I think that is not as immediate, but when you are using the data, part of this data life cycle is how you're using it, how you're honoring the people that gave up their stories. Data is a flashlight, it's not a hammer. And I think it's really, really important to remember that and be very careful.
Thank you. And then we'll pass it to Mo.
Yeah, like Peyton said, it's the trust, right? It's the trust. They have to be able to trust you. You have to get the people to trust you and know that their information is going to be safe. And that doesn't always happen. That doesn't always happen. It takes a long time to build that. And when you do that, I think that it's very important, very ethical to go in there and explain to them why you are collecting that data, and you have to reassure them that you're not going to use any identifiable, information. And then also let them know that, this may be used or it may not be used, but like Peyton said, go back to them, go back and tell them that information that we did, the survey that we did, the data that we carried out, this is how it was used, or if it wasn't used that way. That's how you build the trust. And that's how you, again, you'll be able to get more information later. And we have learned this the hard way with our own community members. You want to make sure that you're looking at their security as well. When you're talking about domestic violence, there are certain things that cannot be, you have to make them feel like it is safe for them to come out and tell you those things. You want to be thinking about that at the back of your mind, even as you're collecting that information. You do not want to compromise the people that are giving you that data. It is important. We want to use it, but we also want to make sure that, the vulnerable people are feeling secure doing it. And then what else can I say? We always tell people, you can do it anonymously, and usually that will get you somewhere. So you can do that as well. It helps. It has helped in our community. But making sure that they understand that you understand the importance of that information, and also to let them know that if they decide at some point that they want to withdraw, they can do that. You allow them the ability to be able to come back and do that. And again, that's a trust building. You're building trust with them as you are doing those things. I think that Peyton said it all, but I just wanted to add in the little that I could think about right now.
Well, thank you so much, Mo and Peyton. Really appreciate your very thoughtful answers. And I know the audience, we can't interact with the audience, but I know that everyone's giving a virtual applause right now. So thank you for that. And I appreciate it. We'll have some time to ask some questions later on, but I'll pass it to Executive Director Peterson.
Yes, so thank you. This is the opportunity if anyone has any additional questions. We wanted to kind of take breaks in between to be responsive because we're shifting topics a little bit behind how is the data collected and then what kind of technology applications could be used going forward. So I did see a question. Let's see here. I think it's actually from Deputy Mayor Howe.
It is actually.
Okay, so Deputy Mayor Howe, if you wanted to follow up with your question.
Yeah, because more recently I was working with a data privacy company, and the idea is that privacy is a human right. So that's one component. But I'll give you a different component, which is if we blew up HIPAA and said everybody dumps all of their anonymized health information into a database, would we be able to cure a disease faster? Because we have more information now that you have a health issue, but you eat blueberries and you sleep 8 hours and you hike, or you never hike, and you have 6 kids or you have no kids, and you put all this data together, would we start to then, through math, figure out trends, sequences, patterns that we would never have seen before? And the specific example I'll give you is that I know a guy who had a wife who was quite ill with something that medical science had said, there's nothing we can do to help you. But because he went literally on a bus and went from city to city to city and asked everyone to dump all of their healthcare information into his database about this particular health problem, he was able to find a medical trial he would never have found out about otherwise. So I wonder, sometimes when we protect information so much, do we limit our ability to learn more? And I'm just curious as to what your thoughts are on just the example I gave you. And do you believe that there is such a thing that you can anonymize your health information in such a way you would feel comfortable sharing it with others?
So if I want to understand that correctly, it's
Yeah.
a question directed more towards the panelists on making
You
sure
know,
that information
It's kind of directed towards the panelists, and I think it'll be something that David could actually respond to also, because there's such a thing as protecting things so close and so tight that we don't get the opportunity to leverage the power of it.
Right.
But I also understand that people could feel so vulnerable, and there'd be that lack of trust. That could I trust an organization where I could share that information and get the benefit from it? So it may be too premature to do something like that with some of the organizations you work with, but in the healthcare field, where we have significant challenges, being able to open up some of that privacy a little bit, where people acknowledge that, yes, it's okay for you to share that data. I understand it's my right to hold it, but if I freely give it to you because I trust you to use it in a way that's beneficial to humanity, I'm okay with that. So I'm just curious if you guys have ever stumbled across this.
I personally I was going to say, having worked in healthcare technology prior to accepting this role, one of the things that we have done with our trials was we actually have assigned unique identifiers and kept that stored in entirely different databases. So for example, if I wanted to say Elisa Peterson responded to these questions, we use the database key to set a number, and then that number is cross-referenced in an entirely separate database that can be shared. So we could tie back and say, this is the number that's been assigned to that person, and it's not a social security number, it's not a birth date, it's not anything like that, but it gives a level of anonymity that then could be passed on, and only that number is a point of reference within the database.
And Peyton and Mo, would that be too scary for your populations, do you think?
Speaking for my organization, our community, I know that we've come across that, you know, to some degree, to some extent. Last year we had an issue where there's a lot of things. Again, it's a culture that is steeped in a lot of secrecy, and you know, we don't talk about a lot of things. There's a lot of things that happen underneath and you don't know about it. But the moment that we said, hey, if one of the leaders is able to come up and talk about, hey, this is what I'm experiencing, this is what I'm seeing. It was amazing that this person made themselves vulnerable and talked about their issue. It was amazing what came to the fore. We came to the conclusion that, you know, this was a deep-rooted problem in our community and that we needed to address it. But it wouldn't have come about if we hadn't had somebody to say, hey, take my information, put it out there. It's okay. I'm okay with it because this is what I'm dealing with. We were able to find that there's a lot of people that are dealing with the same issues, and we were able to look for resources as a community, as leaders, to be able to share to share those resources that we have to the community that we have. So I see where you're coming from, and I can see how it could be useful. However, I can also see the other side of it, right? I can see where I do not want everybody to know my business. Yes, it might help somebody else, but here everybody's looking at me funny now. Like, you know, this information is out there now. We're stereotyped. This isn't a community that is drinks or does whatever, you know. So it's two ways to it. That's that's what I can share about my community.
Thanks for that. Thank you for this question, Deputy Mayor. I think that, you know, I think that from a data perspective, from a health perspective and a medical perspective, it would be immensely valuable for that. And I think that it's important to recognize kind of the historical nature of health and medicine and how it lies on like racial and ethnic and gender lines. And it's not the trust that has been broken was not, it didn't just happen. So I think that while that is, I think, an ideal state, I think there are real fears for folks to release that data to everyone, you know, for any number of reasons, you know, of historical reasons around, you know, how is this going to be used, not necessarily to help humanity, which it might, but also to possibly subjugate me, the folks that look like me, sound like me, or in my demographic. So I think it is a very, very good idea. And I think there is an underlying layer of, to get there, which I think is a goal, there needs to be a reckoning of like, okay, what distrust has happened, what harm has happened, because I think that the individuals that might not want to give up that data, again, privacy is your right, you have a right to not give it up, but are not giving it up because they're being stingy or because they don't want to help humanity, but because they're looking out for their and their own community. And I know one of the partners that we work with works within communities so that individuals within that community are the spokespeople, are working with outside agencies so that there is already a trusted member of the community who's able to, frankly, be brave, be courageous, and speak with, this is not necessarily health, but it applies, speak with health providers or educational providers and speak about for the community, and then bring that back to the community so that they know that, okay, we have a trusted ally out there who understands, who represents us, but also is part of this community, not just someone swooping in. So that is a model that we have, you know, seen, and that's not a model that we've piloted. It's kind of a national model called the Promotores model. But that is something that I know can be a step in making sure that all communities are able to feel safe, unharmed, and supported in going into that kind of endeavor. Because again, I think from a medical and data perspective, I think it's great. From like a historical perspective, I can see that there's work that needs to be done to get us there.
Maybe not so great. Well,
We
if
have
it was okay, I was going to go to the next set of questions.
we have a couple of questions from the audience that I just want to address before we move on, if that's okay, Council. So we've got one question from Jessica about whether or not the recording will be sent out afterwards. And we are going to post the recording on the website. We also would like to get into a pattern, and our long-term goal is to build group discussions that continue on beyond the events. So I'll be reaching out to individual attendees and just saying, is this something, after doing a synopsis of the event and posting it to our website, are you interested in having further conversations? Do you want to engage with the organizations? And so that's our long-term goal. That's where we're headed with all of these forums in 2024. And then Councilmember DeMichelle had a follow-up question, and that was, would people be better served if medical providers could access behavioral health data or information for their patients, and vice versa? So is that something, I think the panelists, if you would like to address that question, and then we can move forward to the next set of questions.
I'm not a healthcare provider, so this is just my own opinion. Take it as you will. I think I would answer the same way that I answered to the previous question. Granted, it's not opening up to everyone. I do think, again, personally, not as any kind of professional in the field, that would be, again, able to provide context, able to hopefully allow the practitioners, those that are providing service and support and whatnot, to get a broader picture of what the people that they're supporting are, facing and what those challenges are. So it may allow for a practitioner, behavioral health specialist, medical specialist, to provide deeper, better, broader, and more like nuanced care. There's still the history piece, but I think that I think it'd be helpful.
Okay, and I see that there is one more question pending, but we'll move forward on the agenda. And I promise, Derek, that we'll answer your question here on the next little break. So we're holding that one for the next 10 minutes or so we can move forward.
So now I'll pick up the conversation and take us into the next set of questions, which is going off in a different direction on the technology side. So this is going to be a question that is going to be directed towards David and Mo. What role does technology play in integrating data across different systems, and what are the benefits? So it kind of all ties together here. So David, if you wouldn't mind kicking us off with that.
Wonderful. Well, thank you. Thank you, Peyton and Mo, for what you've shared so far. I just want to humbly say I am no technology expert. I have thoughts and opinions, and some of it's research. So, if you come in and you want to kindly correct me on anything I say, especially Peyton, who's in the work, I'll be ready for that. But I just want to say that I think technology plays a crucial role in helping us get interconnected. And I think, one of the things I was thinking through this, and I love that we're doing this with the collective impact mindset, right? Because I think as we are talking about using technology to better serve people, better address social challenges, it has to be done in the context of collective impact, where the different sectors are coming together and informing how the data is being used. And I think Peyton and Mo have talked about that really well. I wanted to start there. As I say, I think technology can drastically improve how we're doing things. One of the things, and this might be an area where Peyton can laugh at me or correct me, but I've heard people talk about something called a data lake, which is a centralized repository that takes in data from different sources and makes it usable. When I heard about this, that got me really excited. You can take PDFs and Excel and Word and other formats and put them in a lake and get usable data from it. You can get it to talk to each other and basically get better data from it. And I think that's what's missing. And as we're talking about different sectors, whether it be the school system, hospital systems, police, mental health, homeless providers, right now, mental health providers, right now, a lot of them are, all of them are collecting some level of data. And almost none of them are talking to each other. And so I know that the King County Regional Homeless Authority, one of the goals there around homelessness data is to get those sectors, those different industries to start being able to talk to each other so that we can get, you know, bigger data, better data, and hopefully that good enough data that Deputy Mayor Howe was talking about. And so I'm a big fan of exploring how do we get that. I know that with some of the issues with the homeless providers, which is where my expertise more lies, is that almost all of them have multiple databases that they use because no one database captures it all, and they're doing multiple entry, duplicative work all the time because even the databases that they have do not talk to each other. So a data lake could allow like time saving with this. It could allow these databases to talk to each other and help us get better data out of it. I think some of the benefits would be able to spur more real-time data, which would allow us to look, you know, if we could get real-time data, we could have more strategic funding investments and initiatives instead of waiting. You know, sometimes the data would get 6 months to 12 months old. That's not that helpful. But if we can, technology can help us pull out, you know, dashboards and metrics that we can look at monthly. We can better meet the needs that are you know, coming into our community immediately. I think other ways that it could benefit, you know, that ultimately is going to help people who are falling into homelessness get more quickly connected to the right services and supports, help stabilize them more quickly. I think it can help drive best practices as we're more interconnected and looking at the numbers. We can go, hey, this works, this doesn't. Let's move the system to what works more. You know, ultimately, I'm talking a lot about it'll help interconnect the different sectors, which will help us better understand what's causing homelessness and then get better interventions to deal with it. I think, and tied into what I'm talking about is I think it'll help achieve deeper efficiencies, as right now there are systems where sometimes multiple agencies or people are doing some of the same work with individuals. And if we can use technology to better, you know, utilize the resources that are out there so that people are working together to support somebody, or saying, hey, you've got this, I'm going to now use my time and resources to help this person over there. I think technology has a lot of ability to help improve this system.
Well, thank you. And I was going to take the same question and ask Mo to address it. So again, it's the role of technology in integrating data across different systems. What are the benefits?
Thank you, David. I think that he said it all, honestly. That's what it is. You know, what are the advantages? I think it's having that. I like that term, the data lake, right? That's a that's a beautiful term because I feel like, you know, that's exactly what we're talking about. If we could all be like different agencies, have one place where the data is stored, it is standardized. You have the same terms and everybody understands the language and everything that's in there. It'll be so much easier and time efficient for everybody that's running these programs. Let me give you an example of even in care coordination, right? You have sometimes you have and this has happened to my organization where we have a woman that lives alone in their home. They're older and they need help at home, but they're not getting it. What happens is that every time they try to go to the bathroom, they are falling, and when they fall, they're calling 911 and they're going to the ER. You know, now they become so good at it that they're going to different ERs. So instead of going to Valley, they'll go to Overlake, or they'll go to different places, you know, and then you get a call, you know, from the social worker saying, hey, I've got this lady that needs help. Do you guys want to come out and help get her situated at home? Well, it's the same lady that we have served 5 times. You know, if we had data that was centralized, it was in one place, if you pull up her name, you'd be able to see that, oh, she's done this before and she's in here. What supports are there? What can we help her do so she's not a freaking flyer? You know, that's what that would help us do, interoperable systems that would help us be going to that lake and pull out the things that you want to do. It'll be very easy for us to help clients, homeless clients, people who are needing services in real time, because you'll have this name will pop up and I'll know that this person is in Renton. And then I've got this person who works in navigation, housing navigation in Renton, and they can go out there and get it. It'll happen versus calling 211 and then you're on hold for God knows how long, and they give you a number to call and all these things. It would be so much easier if we had one system in there, standardized. You have maybe you even have a list of names that are in there, you know, for people who are needing these services, and you're able to pull it up and you're able to say, okay, this one is going to this agency. That's my addition to that. Otherwise, I think I liked everything that David said.
Well, thank you for that answer. I could go to the next question, or did you want to answer some questions from the Q&A?
Well, we can, while we're still on that same topic, and before we move on, I know that Derek Franklin and Helena Stevens had a couple of questions. And for Derek, and normally we would wait, but I think that there's such a good conversation around this, and particularly as it applies to healthcare, that I appreciate the opportunity to pause, Deputy Mayor. So Derek Franklin said, what is the potential for providers, municipalities, or other health sectors to better agree upon some kind of universal data set or metric that might then support better downstream alignment or intervention strategies while still allowing complementary collection and use of local data that honors community and culture? And we have to read those aloud just because of the fact that this is a recording. And so if we just started answering the question on the screen, not everyone who hears the recording would know.
You know, I'll
Yeah.
take the municipality part. What is the potential for municipalities to better agree on some kind of universal data set? Wow. Good luck with that. So it's hard because we are trying to do that internally within municipalities now and jurisdictions to try to have a common language to understand even what the scope of a problem might be. We use the language of code, city code. And because we all understand what that city code is in terms of how many houses you can build, for example, on a piece of property, we all know what that means. And so by having a common language, we're better able to understand and relate to each other's issues and concerns. But I'm curious, you know, I'll let others respond to this question as appropriate, but we have that's kind of it's clumsy, but it kind of works. It gives us a common language.
Yeah, it is in fact this, so to Derek's point, it is the entire basis for collective impact, which we all strive to do, but deciding what that universal set of data is kind of where we're at right now. It's the benefit of this conversation so that when we're working in this data lake environment, that everyone is really well aligned. And I know I've talked a little bit about my own career history, but I was an analyst for the police department. And when Mo was talking about those instances, I remember when before we actually had shared data with other police departments, I remember I was going through some records and had found that this child, over a 12-year period of growth, had been victimized. And in each instance where that had been recorded, the child's name was spelled slightly differently. And so I had to, I actually had, and I'm speaking vaguely enough that I could talk about this case, but in each instance, the police would respond to this house. The child's name was entered with a different spelling such that they didn't know going in there that the child had been reported before for being harmed. So we actually were able to take all of those and batch them into one single document. But then I was able to alert the detective going out there to say, hey, would you look for the child and see if they're still in the home? And if so, can you just check in with them and make sure everything is going okay? Make sure, contact social service providers, make sure those wraparound services are available. Because over that 12-year period, we're talking about a child who was then 4 and is now 16, right? At that point in time. And so these data lakes are extremely efficient, but you have to have the exact same fields. You have to have the exact, it has to match in such an identical way that that everything will come together in one single record. So that's my personal experience on that, but I didn't mean to interject too much there. Peyton and Mo and David, do you have some thoughts as well?
I'll weigh in and just say that I think, I mean, your question is what's the potential? I think Deputy Mayor Howe talked about it. That's hard. But I will say that our organization, we are working to try to realize that potential. Our goal is to figure out how throughout the county, in particular East King County, we can have a shared homeless information sharing system with a shared database that can be used to, and get to a by name list, and that can be used by decision makers to make informed decisions. Now, as I say that, there's a lot there, right? It's like, well, who are the decision makers? What are these shared database and what is the metric? So I think I bring that up to go, I think it has to start with collective impact and end with collective impact. You've got to get the stakeholders, the diverse stakeholders. You've got to get the people that are on the streets. You've got to get the different cultures together to go, what is this? What can we agree upon that we can gather and feel comfortable and safe enough to share and use that data? And so that takes time, that takes bringing people together. So that's why I love that this whole conversation is being talked about on the foundation of collective impact, because I do see huge potential for having a more effective, efficient system. And that's going to take time to accomplish, but I think it's worthwhile.
And I do see Derek had a little bit of a follow-up question, and it's using an example. It says an example would be a Washington Healthy Community Survey, like the Washington Healthy Youth Survey, that uses representative community voice to continually refine survey questions and application. And then Derek says, thanks for the opportunity to ask. So do you have any more thoughts on that, Mo or Peyton? Okay, so I see Helena Stevens said to all of the panelists, after gathering data for each of your organizations and coming up with trends, do you have a trend discussion? And if so, with what groups and how often? I know that
I can
Peyton
go.
has experience as well on that too. So yes, please jump right in.
Okay, yeah, for our organization, we do have those discussions, and we always try to tweak. We have conversations with our community leader, with our community members. We have town halls, and then we do surveys as well. And when we see a trend, we're able to weigh in a little bit more and then ask deeper questions towards that. So we'll go back. If we ask the question, it was a little bit vague, maybe we'll make it a little bit more pointed so that we can find, we want it to be so granular that we're able to collect that information. I'll give an example. When we were doing mental health, we were asking what is it that people want to talk about during COVID? What is the biggest thing that's going on that is a problem for everybody? And when they said, well, we want to discuss this, we were able to go back and refine the questions so we can find the pointed answers to that. And when we do that, as a board, we'll sit together and decide, okay, how do we move around with this? Can we invite the city to come in? Can we go and see maybe mental health specialists? We have people in our community that know our culture, that have got a lived experience, and are able to speak with people in the language that they understand, in the context that they understand it, know how to ask those questions. So we'll go out there, and we always are looking for capacity. We're always looking for resources. We will take that information to our funders and tell them this is what we found out. And we feel like, if we had this much money, we'd be able to get these practitioners into our community to be able to help us. So we do follow up, and we do discussions with boards, and then we also go across, from the community, other CBOs in our coalition. We have maybe the Congolese, maybe it's the Tigray community or the Angolan community, who are usually going through the same things that we're going through. We want to find culturally relevant solutions for our people. And so we'll go out there, look for funds to be able to bring together a solution to our people. So that's, I'm not sure if that answers your question, but this is, I'm speaking for my community here with the data that we collect through our surveys.
And I'll just jump in. Thank you, Helena, for that question. I think that for Eastside Pathways, at least for our organization, because we're not doing necessarily direct service as it relates to human service organizations, we're supporting those organizations. One of the things that we are always trying to do is make sure that there are like small changes. So when we see a trend, we recognize that something has or has not happened. And I think that we want to do two things. We definitely want to have a discussion of what is happening with any particular demographic that our organizations are working with, but also taking the trend, and I spoke about this a little bit earlier, in context. So what are the larger, what larger systems are at play, be them housing, criminal justice, food, education, what do these trends reflect that the systems are or are not doing? And then we're able to really speak with organizations and also with community to really validate, is this trend kind of all that it's cracked up to be? Do these numbers mean what we think they mean, or are there further contextual factors? I know that when at the beginning of the pandemic, we convened a number of organizations, and a number of, obviously everyone knows, a number of things were acutely happening, and looking at some of the trends, trends within education around engagement, kind of a lack thereof, around food insecurity, around kind of the need for folks to get assistance that normally might not have asked for assistance, and figuring out what these things were happening, and validating why was there engagement, why was food insecurity happening when we had partners that had a lot of food, but they weren't getting to communities that needed food. So being able to connect and contextualize these trends so that they don't just live alone is something that we've kind of tried to do as we work with the different organizations that do the amazing work to support these communities.
So I'll go ahead. We've got a couple more questions that we'll try to get to here in the time that we have. So this question again, to David, I'll target it to you. How can technology such as mobile apps or wearables enhance real-time data collection for assessing housing needs and service utilization?
One of the things that when I joined ECDF, early on, I was talking to one of my board members, and they did a ride along with a police officer, I believe it was in Kent, and spent a whole shift, and it was like an evening shift. And they drove around and did and saw, kind of a whole shift of what the police officer was dealing with. 80% to 90% of the calls were people experiencing homelessness or people experiencing mental health issues on the streets. And what this police officer shared at that time was, I feel powerless out here. All I have is 211, which is a great organization, to call. But they said, I give that number out. You're often on hold for a while. I don't see people calling it off, and I don't have time to wait around for being on hold, and it's not in operation after like 5 p.m., right? So it's very limited. And so we are having discussions like, how could we improve this? And one of the ideas was, what if we started searching for, could there be an app that was created, a web-based service app that really compiled the social services, supportive services, and shelter opportunities, mental health, addiction, food, all that you could arm the community with. And if a police officer's out, and I'm talking about police because they often are the first people to come into contact with someone who's fallen into homelessness. Police and fire are often those first responders or outreach workers. And if they were out there and if they ran into someone who said, I don't know what to do, and they were able to pull up an app that said, okay, you're a male with a dog, or you're transgendered looking for mental health, whatever it is, and you could just quickly pull up an app and go, oh, you're going to go to the Sophia Way, or you're going to go to Porchlight, and here's the address, and here's the bus to take you. So we're looking at that, and what that could do is that could, once you're working with technology, it's keeping information on the back end, and you could see, hey, where are people at? Where maybe there are homeless hotspots that are being created, and what's that about? It's like, looks like 60% of the people are trying to access shelter from this part of the county. Maybe we need to then look at investing some programming and funding into that section of the county, because that's where most of our pings come from. Or, hey, this part of the county, they're not asking for shelter, but they're sure as heck asking for food banks. Maybe we should look at what's the food bank situation and can we enhance it? So I think there's a lot of opportunity there to use apps or potentially wearables, but apps I think would be better to arm the community. That creates hope. The community goes, hey, I can do something that's in my capacity and I can do it now. You could also put QR codes around, like, transit centers and libraries that people are experiencing homelessness. It says, need help? Click here, because a lot of people have smartphones. They look at that and all of a sudden they've got an app, right? And so you're arming people who are really, like deer in the headlights, really struggling on the streets, and the wider community to know how to do something. So I'll pause there, but I think there's a lot of opportunity for us to be able to use data to better understand what the issues are, where it is, and do targeted funding and programming.
So Mo, would you agree with that?
Yes, yes, definitely. I agree with that. I think that the response would be immediate if we had those apps and people could have access to it, and we would be able to figure out where it's happening. Where is the problem? Where the homeless people are? If you had the wearables, for example, we used that last summer. We had a program where we had some of our members wear. Use the app called I think it's gosh, I can't remember what it was, but it was monitoring their walking and their food intake, and we were able to see what the trends were in our community. We weren't able to do whatever, but we wanted to gather details. We wanted to gather data about what's going on, how is everybody's health, what are they doing to exercise, and what types of we were also looking at culturally relevant food and trying to see. So everybody was able to track their food intake, their walking, their exercise on a daily basis. And together we would come up after a week and look at the data and see where it was at. And it was easy for us to be able to create a program around that with people in certain age groups to be able to create a wellness plan for them. So those are very important. If we had them, they would be able to tell a story. And the stories is what we have, is what we want for our community, to be able to gather that information. So I totally agree.
So Mo, I'll just direct this next question, which is our final question, to you to start, and then to David to conclude. So what challenges exist when collecting data on vulnerable populations, and how can we address those challenges?
I think it's what we have said in the past, those populations are vulnerable, they're the ones that are they're very, very hesitant to share their information because they're vulnerable, right? We want to create a trend. We want to create trust in them. It's building that trust. And that means that going to them and speaking with them and showing them that you mean what you say and that you are there for them. You know, we also want to respect people's cultures and diversity. You know, we want to share, we want to talk to them in a language, in a culture that they understand, ask those questions that they're able to understand, that they know how to do it. So building that, recognizing those shortfalls, letting them know what the data is for when we're talking to them, and letting them know that they have the power to give that information, to consent to it, how to consent to it, and they can also take it back when they want to. That is one way of building trust. Those are the challenges. And some of the people, again, that we're speaking with the vulnerable populations, there's language barriers, you know, there's the education, the literacy levels as well. You know, there's also, do they have the resources? Do they have these smartphones? Do they have internet? How do you connect with them? Where are they? Are you able to get them, you know, to get to where they're at? And the people that are doing that work, do they have the capacity? Do we have the bandwidth to go out there and meet them where they're at, you know, where the people are? There are so many more challenges that I can talk about, but I think that we have talked about these, and these are the ones that I see more prominent in my community that we need to address. Yeah.
So David, how would you approach the same question?
Well, I just want to say, I think Mo's sharing about that, I think really fits really well with what I was going to say, and I'll say a few more things as well. But I do think one of the things I've experienced is all too often, by the time someone is getting to calling your service, they've had so many failures. They've had so many people not answering the phone call. They're struggling with hopelessness, with feeling rejected, struggling with their sense of identity. And then oftentimes you'll have well-meaning people out there making promises, because it's hard when you see someone desperate. And I think we have a lot of new case managers, and sometimes one of the faults people make out of trying to do good is to make promises they can't keep. And that's one of the worst things that can happen. But I bring that up because that's a reality of this sector. And I bring it up because those are failures that stick with people trying to access our system. So like Mo said, I think one of our biggest challenges is rebuilding trust. And the way to do that is you got to do a lot of listening. You've got to stay in relationship, and you've got to show you've listened by incorporating the ideas of the people who are there and listening to their fears and concerns, and then not over promising, never promising something you can't deliver. And then slowly build back by showing, you know, successes there. The other thing that I think is a challenge when I think about data, so I used to, you know, run I played many different roles in Porchlight, formerly Congregations for the Homeless. And I did intakes for many years. I did, you know, I did the programs, and then I was executive director for many years. And I had a real problem. I think there's a problem between collecting the data and what is done with the data, that people who share their data often have no idea what's being done with the data. And even if you give them a little bit, you never follow up and say, let me tell you how you sharing your story and sharing your stuff made a difference. That, I think we've got to bridge that gap and figure out how we can tell the story around you sharing your information is making a difference. Because I struggled with staff. Right. I struggled to get staff to ask questions well and take data gathering seriously, because they too were like, well, I don't know what's happening with this data. I take it and it's gone and I don't know. And so I think we have a little bit of a black box issue where stuff goes out and nobody knows that it's doing anything. So I think that is a challenge in our system. I think other challenges are just state and local regulations on privacy and how to collect data. You know, I think of, you know, I'll take, you know, I know homelessness well, right? Porchlight is a shelter where they have case managers, and I've heard stories, and they have a mental health workers. I've had stories where somebody became a mental health crisis, ended up at Overlake Hospital. the mental health director called Overlake and said, our guy's there, we've been working with him for 6 months, and they go, we can't even tell you if that person's here, right? Which is, so there's a missed opportunity for that, for those two professionals to work together on behalf of this person. And I'm not, I mean, what Overlake did was perfectly the right thing to do, right? There was not a release of information, but we've got to look at, are there ways to make releases of information easier so that when people are in crisis, we can get the team of people who care about them working on their behalf. That's part of it. I think you've got CCAT teams, which are, you know, co-response police and mental health workers. And because of HIPAA compliance, they can't share much. I think there's opportunities for us to have shared databases with different permission levels where certain people can see certain things because of HIPAA compliance, and others can not see that, but they can see something on behalf. I think there's opportunities there. That's a challenge and an opportunity for us to look at. I think, you know, as somebody who built up a what I'm going to say a fairly fragile data collection system at the largest nonprofit dealing with homelessness in East King County. It's a fragile system, and we there never got any direct funding to build out the data infrastructure system and gathering. And I think we need to invest in giving nonprofits the infrastructure and funding to be able to adequately gather data. You know, when I go around, there's some that have several databases that they often are using inadequately because of time and funding. There's some that are mostly using Excel sheets because they don't have the money to get a database, a proper database. That's happening right now in East King County. So I think if we had a plan and then came up and said, what metrics do we want to share? How do we want to gather them? And what are we going to do with the data? I think is something, an issue. And then, you know, I got to take this opportunity to share about one of the biggest challenges, which is paying living wages to our frontline staff. The frontline staff are often the first point of contact to gathering data, right? And I'm going to change this to, I think Peyton and I think Mo both spoke about this beautifully. Data is someone's story. Usually I'm talking about that we're getting somebody's life, vulnerable, personal story, and frontline staff are gathering that and turning it into boxes and usable data that can be helpful to move them forward. Because we're not paying livable wages, the turnover on the front lines is happening all the time. So just about the time you get someone trained well enough to ask the questions correctly and get it in the computer, they leave and you've got to start over. So we are not getting quality, good data in part because of what our frontline staff and nonprofits are getting paid. Now, let me get to a bit of what I think of some potential solutions. I think the collective impact wave, we could build a coalition of different stakeholders to come together and talk about what could be a shared database that works for everyone. What are the metrics and what's our data sharing guidelines, and who are the decision makers? I think that is an opportunity for us. I think we need investments in the infrastructure of collecting data and the staffing to be able to support the front lines and others to get good data. And so we can look at that, invest in livable wages, you know, incentivize providers to adopt new systems. Change is hard, right? If you've been doing something, even if it doesn't work well, people often get stuck in, especially if they're not given incentives to move away. So we've got to incentivize that. And I think also building deeper connections, incentives between the tech sector and nonprofits. The nonprofits, they come into existence because they want to do something really good for social services. They want to address mental health concerns, homelessness, you know, addiction issues, food insecurity, all of these things. And then they're told without adequate resources, oh, by the way, start gathering data and figure out what the best database is. They're often not the best for that. If we could pair them with this rich tech sector, and I mean rich as in there's a lot of them, although they are quite rich, to help support them and give advice and technical support that way to build out the system, I think that is a real opportunity.
So we are nearing the end of our time for the session. I wanted to say there's some information that came up in the feed about sharing information in crisis, confidentiality, +1 on the frontline staff pay. And so we are planning to reach out to everyone following the event, like I mentioned. It would be great to get everyone involved in all of this collective impact. These forums have been an excellent opportunity for that. So I would just say I shared my contact information with everyone who registered for the event. Please reach out to me and let me know what you would like to do going forward. If you have thoughts, if you have questions, we're going to keep this on our website. It will probably be posted tomorrow, hopefully by Monday. I have a child going to senior ball tomorrow, so I can't make any promises. She has a lovely dress. So I will do my very best. We're all just human here. But this has been an exciting conversation, and I'm so grateful to all of the panelists for your involvement. So I hope everyone has a wonderful evening. We will definitely keep in touch, as they say. And thank you again to the panelists for everything you've offered with all of your insights and wisdom tonight.
Thank you very much for having us. It was beautiful. Thanks to my fellow panelists and everyone here.
Thank you.
Thank you.
Have
Thanks.
Thank you.
Good evening, everyone. Thank you so much.
Bye.